Hey guys, Antonio here with Enhanced Movements. I'm going to go over an exercise I like to give just to help people kind of repattern a hip hinge. Usually patients that are having low back pain, and specifically like a flexion intolerant low back issue. Repatterning this hip hinge is a great exercise so that when they're brushing their teeth, going to reach to flush the toilet or washing dishes or anything like that, we can kind of repattern that hip hinge so that we put the load in the glutes rather than the low back. So what I'm referring to is, let's say for instance I'm bending over at a sink, washing dishes, brushing my teeth, in my normal positions, kind of just to do this. It's not a lot of hip flexion, but it's really enough, especially if you're super sensitized to the pain that you're currently having, to kind of really flare up your back. So what we want to try to do is to kind of sit back more, where we hinge to put load in our hamstrings and our glutes. I do this standing exercise as well as kneeling. I kind of like starting kneeling first because it's a little, in my opinion, easier to kind of gather, taking the lower part of the leg out. But essentially what you need is a broomstick or anything long. You're going to put it along your back. Head, mid-back, and sacrum are touching the Piper broom. And essentially all I want to do is try to maintain those 3 points of contact the whole way. So I'm kneeling nice and tall, and all I'm going to do, maintaining a long spine here, is push my butt towards my heels. Now there's a couple ways we do this. Sometimes people will think that, which isn't necessarily wrong as long as I'm trying to keep this. It's teaching the hip to dissociate from low back movement. But what we're trying to look for is, for every inch my hips move forward, I want to think about my head moving forward an inch as well. So if I go back an inch, my head also goes forward. Okay? So it's going to eventually kind of look like this. Once the patient starts to kind of realize and understand, and more importantly feel how this is done, we just keep hitting it, and we just add reps, sets and reps, so that they really start to feel like what it is, and then it just kind of repatterns and reprograms. Same thing can be done with a band. Now you can tie this to a door or anything like that. I kind of like holding this here. Now what it does, it adds a little bit of an external force that wants to pull my upper body back. So I really kind of have to focus to maintain and brace my core as I start to do this. So it's not a lot of tension. You shouldn't be having to like lean into it. But it's enough where it just kind of teaches and trains my body to really engage that core and keep this tight so that I don't round into my flexion, right? I don't do this. I got to maintain a straight back. As I pull back, that comes forward. Okay, so it's just another way, or it's just another tool to kind of train the body into adding that hip hinge. Okay, try this out if you're having some flexion intolerant low back pain. Be sure to check out some of our other videos, share it on social media, like us on social media if you haven't done so already, and if you have someone who's struggling with low back pain, or you are yourself, feel free to reach out and ask some questions, and hopefully we can help you out. Thanks for watching, guys.